Welcome everyone. Thank you for joining us today. I'm Theresa Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. For those of you who are awaiting test results for COVID-19, you can now obtain your results online. Please check the Ministry of Health's online portal. You will also find the link on our website. Please note that you will need your Ontario Health Card number to access your results online. With the number of tests pending, results may take up to 7 days. Once you have received your results, you will also be given instruction as to next steps. Please remember that while you are awaiting your results, you must remain in self-isolation. Overall, 3,916 individuals have been tested for COVID-19, and of those tested, 687 tests are pending. I will now share the most current case counts. There are 34,786 confirmed cases of COVID-19 in Canada, and 10,578 cases are in Ontario. Chatham-Kent has 29 cases, and Sarnia-Lambton has reported 145 cases. Michigan now has 31,424 cases, with 7,604 cases being in Detroit. Today, we are reporting 482 cases of COVID-19 in our community, an increase of 20 cases from yesterday. 80 cases have been resolved. 24 people are currently in hospital. 18% of our total cases are between the ages of 50 and 59 years, and 22% of our cases are 80 years or older. 38% are male, and 61% are female, and 1% are unknown at this time. Our community has lost a total of 27 people to COVID. 20 deaths have occurred in long-term care and retirement homes. Our health unit continues to work with 7 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. Testing for COVID-19 is based on a clinical assessment. Symptoms of COVID-19 include fever, cough, and difficulty breathing. However, other symptoms may be present, such as being extremely tired, falling, nausea, vomiting, chills, and headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are 3 options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. They will be able to guide you in next steps, including contacting public health or attending an assessment center. Windsor-Essex now has 2 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. This includes healthcare workers, caregivers, providers, and first responders. Also, residents and staff in long-term care facilities and retirement homes, and residents in the community referred for testing by the health unit or the primary care provider. Please continue to visit WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. Exactly a month ago, we announced our first case of COVID-19 in our region. Since then, our case count has gone all the way up to 482. The question comes to everyone's minds is, are we doing good, bad, or okay? I would say we are somewhere in between okay and good, and this is a big thank you to each one of you who is following physical distancing, washing their hands, staying home when they're sick. Without you, we wouldn't be here. We have seen how quickly COVID-19 spread in the community, but thank you to each one of you for following the public health measures, doing your part, and limiting the spread of COVID-19. Every one of us understood our personal responsibility and also played an important part in our social and collective responsibility. We are coming closer to the finish line every day, but we are not there yet. Any wrong move can send us back to the beginning or even at the worst place. Everyone is following the recommendation for more than a month and now, and I want to thank you for doing all that. but I know it's not easy and it's not over yet. It's not easy to sit at home, especially now when the weather is getting better. We want to be out there. We want to hang out with our family, friends. We want to do our barbecues. We want to go to the beaches. We want to go to our park. We want to go to our riverfront. We want to do more. But now is not the time. Every one of you who worked really hard to get where we are, we just need to continue what we are doing right now and break the chain of transmission and limit the spread of the disease in our community. I request you to please continue what you're doing in the community and follow these measures. As we continue to focus our attention to the most vulnerable in our community, our team is finalizing our strategy by engaging the city, the acute care hospitals, and other agencies to finalize the response plan for COVID-19 for congregate setting, homeless population, shelters, and other congregate settings. We will be reaching out to the city and county to request for spaces and temporary housing arrangements for this group. We will be reaching out to the hospital and ask them for support and provide care to these individuals. It is wonderful to see how we have all connected to work on the greater good, to keep our community safe and everyone in the community safe. The Windsor-Essex County Health Unit is also proud to team up with our local primary care partners and hospitals to launch the COVID-19 Population Health Navigator. The Navigator tool, which will be live for Tuesday, April 21st, can be found by visiting our website, WECHU.org, or going directly to ehealthwindsoressex.ca. The eHealth Windsor-Essex website provides a one-stop shop for local residents to connect with a healthcare provider, attend a virtual walk-in clinic, and or check with their symptoms of COVID-19. The online tool to be launched tomorrow will ask a series of questions about an individual's symptoms, travel history, and exposure, building from the COVID-19 case definition that is currently being used by all the healthcare providers. If a medical assessment is indicated based on the responses provided, individuals will be linked to a triage portal to arrange a same-day virtual medical assessment with a local primary care provider. This tool is a welcomed innovation for Windsor and Essex and is responsive to the needs of our community. To be able to walk through the self-assessment and quickly link to local primary care provider, it is not only convenient, but also can relieve some of the stress for these individuals during this difficult time. Dr. Jennifer Bondi will join our Facebook live stream tomorrow to provide an overview and walk us through this exciting new tool for our community. Thank you.
We'll now take questions from the media. We'll start with the Windsor Star.
Sure. I'm just wondering how the transfer of residents from long-term care over the weekend to the field hospital went.
So that undertaking was done by the hospital, the long-term care home, and the EMS that are involved in the transfer of these patients. What I heard is it went well, and there are now at least 21 people who are in this at the Sportsplex facility at the temporary hospital, and they are being cared by the staff at the facility, supported by Windsor Regional Hospital.
You said that was 21 people?
I may be off by one or two, but that's my understanding.
Okay, and then last week you were sort of talking about ongoing plans to continue that process with the hospital and finalizing details of that. Can you talk any more about what that process will look like going forward, which residents from which facilities might be moved there?
So when these determinations are made, there are a number of factors that we need to consider, especially the ability for these long-term care homes to provide care to these individuals. Some of the facilities may be in a better position to provide that care by keeping the individuals who may do well in that type of setting. The only issue is, do the home have the resources and the capacity to provide care to those individuals? So that's basically the first consideration. The second consideration is the number of residents that are in that facility, and how many of them are positive with COVID. And is it a good idea to move all those people that are positive to these facility, or maybe do the opposite in case if the facility is it has too many cases? And then it goes all the way back to the staffing issue, that if there are a number of staff that are also COVID positive, and if the homes have the facility to provide care to those individuals as well. And then first and the most important part is their clinical situation. Some individuals may do well if they are moved to a different place and all their clinical needs are met. Some may not. So I think all those discussions and conversations are happening and will continue to happen before we can say that we go home by home and identify that this is the home that we are targeting and then this will be the next home. I don't think that should be the case, but all of these options are discussed and currently being looked at, and I'm hoping that with this move, it'll be in the best interest of the patient and best interest of our community.
And do you know if it was only residents from Heron Terrace over the weekend that were moved, or were multiple homes involved?
Right now, my understanding is it's just one facility is transferred their patients, and others may participate as well. But I'm not aware that if a decision has been made finally.
Okay, thank you.
Any questions from Amy Hundred?
I'm just looking at the number of cases here in hospital, 24 and 13 in ICU. This is the highest number that we've had in ICU so far, and so is that at all concerning to you?
Obviously, this is a concern because that's where the most sickest people are going to end up in the ICU and on the ventilators. And we read the report that based on a per population size, the number of cases outside of GTA is highest in Windsor-Essex for people who are needing that ICU care. It is concerning, and we are hoping that all those people who are in ICU, they are recovering well. Most of them are, but it will continue to be a concern for us, for the entire community, and we want to do all those things proactively and not letting people end up in ICU.
And so just a quick follow-up, you mentioned about us being outside the GTA having the highest number of people on ventilators. Are we at risk yet of ventilator shortage, do you know, or are we okay in terms of that?
I believe we are okay with respect to the ventilators that we have right now, but situation can change, and I think that's where most of these risks lie when we are talking about all these surge and all these planning. All these plannings are done at the front end of the things to not to get us to that point. But so far, what we are seeing, we are doing relatively okay. We haven't gone to that surge capacity at this point or looking for that the extra bed or extra ventilator in the community. We are not there yet, but not to say that it cannot change. It can change, and that is why taking some of these even proactive measures in the high-risk population or vulnerable population with maybe multiple comorbidities, if we can try and prevent them from collapsing up to a point where they need hospital care or where they need ICU care, that doesn't happen. And I think all these measures we're trying to prevent that from happening in the first place.
Do you know of the people in the ICU, are they people from long-term care homes, or do you have any type of breakdown like that?
I don't, at this point, I don't have that breakdown.
Okay, thank you.
Any questions from Blackburn?
Yeah, so kind of off topic a little bit, but not really. Apparently some firefighters in Toronto and Sarnia have been told not to use CPAP machines for fear that it may spread COVID-19. Have you heard about this? Have firefighters here been told similar things?
Well, in general, we got this question not from the firefighters or what they're doing, so CPAP machine, and if it may have any impact on the spread of COVID-19. If you're really looking at an individual who is positive for COVID, and if they are using a CPAP machine, and just because of the way of action, what happens is an individual, when they are breathing out through this machine, and the machine just sends this their breath out in the air. So anyone in the room at that time could be potentially exposed to that virus if the person is infected. And that's why if someone is in that room and they are COVID positive, they shouldn't be, first of all, they shouldn't be in the same room. But if they are there, just giving themselves time to, when you're providing care to those individuals, you can try to use a mask when you're providing care, and a 95 mask as a healthcare provider if you're in that long-term care home and those type of facilities. But at a mass level, at a population level, at a general public level, I don't think that this is any issue. Someone who is COVID positive, they should be in self-isolation. They shouldn't be in a room, same room with anyone else, period. So that should limit any concerns on those individuals.
Any questions from CTV?
Earlier you used the phrase closer to the finish line. When you look at the numbers and the trends we're seeing with senior citizens, how optimistic are you feeling that we're flattening the curve or beginning to?
So good question. So when we are looking at those spread, so we try to look at the community spread. We try to look at the institutional spread. So institution, we know even one case, we, based on the new definition and based on the best interest, we consider that as an outbreak. But typically outbreak, it doesn't mean that you have one case and we declare an outbreak. The whole idea of declaring an outbreak earlier on in the phase is to try and contain the disease as much as possible. The challenging part is, even if you have one case at any of these facilities, it spreads very quickly. So it's not a function of what is happening outside, it's a function of what's happening in the inside of the facility, whether because of the staffing issue, because of the IPAC issue, because of the PPE issue. There are a number of factors that goes into play before the home get into that situation. And if all this work that we are doing right now, if we can do that, and if there's no community transmission happening, what would happen is there won't be anyone to bring that COVID-19 into those facilities. So we need to work on both front, and the more important one is the community front. We have seen a decline in the community cases. That's great. But now we also need to make sure that what is happening in these facilities, we are able to contain it, and we are limiting the spread. Going back and forth in the community, I think that won't happen just because of some of the new measures that are currently in place. All the staff working in these long-term care home, retirement home, they are asked to wear a mask all the time. They're doing active screening. They're doing their temperature check. They're monitoring their symptoms twice a day, every day. And with all these measures, the likelihood of someone bringing anything from outside to the home is, we're trying to reduce that risk to almost minimum. Now, those homes that are currently in outbreak, they need to be looked at and provided all the support that they need to try and contain it. It will take us some time, but we are hopeful that with all these measures, we will be in a better position.
Any questions from CBC?
Yes, good morning. I know you're still testing people in long-term care homes, and you were looking for asymptomatic people. Have you found any people that were asymptomatic yet?
So good question. So let me just give you a quick answer. No, we are not looking for asymptomatic people in the long-term care home. They have to follow a certain criteria before we even consider them for testing. The idea behind testing an asymptomatic individual, it creates a whole lot of problems, and without giving us any benefit. If someone who's negative and asymptomatic, it really doesn't give us anything. That same person can be positive 2 days later. So it is a false impression that when we are saying that, yeah, swab everyone and all the asymptomatic people without any risk, that's not the right approach. What we are taking, or we're trying to take in most of the part, is anyone who would be at risk of developing the disease. That means anyone who either lives in close proximity to a case, anyone who is still asymptomatic but was cared for by a healthcare worker or a staff with a high risk of transmission there. So we took that approach, and then we tested all those individuals. And then if there are very few people who are left in the facility, we tested those individuals as well. So just to be clear, the idea is not to test everyone who is asymptomatic. The idea is to test people who need testing, and there are some clear guidance on that. Having said that there are now like some homes that we have completed a good number of people and residents and staff tested already. We are awaiting results on those people, and if we are looking at the number of test results that are pending, that is also an indicator of how it has impacted on the testing capacity of the labs. So we need to find that balance, and people who need testing, people who with the outcome of having a positive test would change, we should be able to get those results quickly. So all of this is happening. Now we are talking more about the congregate setting piece. We're talking about homeless shelter. We're talking about people living in assisted living type facilities. Those people need more support, and they need some level of care from the community. And our team is now in the finalizing stage of all those details being worked out right now. And with the support of all our municipalities and also our healthcare workers, we will be going in and do some of the same thing that we are doing with the long-term care homes, and ensuring that their needs are met. And that will be the focus moving on, in addition, like from a testing perspective, and everything else will be done from a support perspective to the long-term care home and retirement home. And we're hoping that taking this comprehensive approach, we will be in a better position.
Okay, thank you.
Any further questions from Windsor Star?
I'm just wondering, have you begun testing the homeless population, or is it very much in discussion and that will happen very shortly?
There are things in place already that anyone who needs testing, we are testing them. What we are talking about is a systematic approach to identify proactively and take some of those measures proactively. We do have a system in place that anyone in these homeless population or shelters, if they are having any symptoms, there is system in place for a nurse to do the assessment through us, through CAC, and then based on the assessment, if that individual needs a swabbing, that is happening either on site or maybe at a referral to the assessment center. And if in between, just like anyone else, if they need any housing support, that is currently being provided to them until they wait and isolated as just like anyone else in the community. But when we are talking about any systematic approach and systematic mass testing, that needs much more coordination and much more effort. But I want to assure that there are already these systems in place, which is actively looking for these people and these cases. And all these proactive measures is to pick up those cases early before they start to exhibit symptoms and start to show more explicit sign of COVID-19. With our proactive approach, we are confident that we will be able to pick up the cases earlier before it spreads further in that population.
Thank you.
Any further questions from AM 800? Any questions from Blackburn?
Okay.
Any questions from CTV?
Yeah, just one more. You said there are 687 tests pending. This number is higher than what we saw last week. What's causing the backlog?
So there are a lot of testing that's happening right now in our community and other communities as well. Some of them are proactive testing, and as you can see, the lab capacity. It is also dependent on the lab capacity to process that information, process those testing. Hoping that all this with backlog will clear soon, but this is also a systematic issue that we are trying to address, and that's why I feel that it is important for us to, especially at this time, to be vigilant, be open to test anyone who needs testing. But when we're talking about asymptomatic people getting tested, we should take a balanced approach and not to overdo it, because whatever we do from doing more testing perspective, it will have an impact on the reporting perspective. And we don't want to miss some of those key people who need the results quickly than the others. Okay.
Any further questions from CBC?
No, thank you.
Thank you, everyone.